Pnawn da, fi yw Cynhadledd Morgan, Gweinidog, Iechyd a Gwasanaethau Cymdeithasol yn Llywodraeth Cymru. I ni tua hanner ffordd drwy'r cylch adolygu sy'n digwydd bob tair wythnos. Felly, heddwi dwi am roi'r gwybodaeth diweddarau i chi am y sefyllfa o ran iechyd y cyhoedd a'r cynnydd yn ein rhaglen frechu. Byddai hefyd yn sôn ychydig am y bleidlais yn y Senedd y pnawn yma i ehangu'r defnydd o basys Covid yma yng Nghymru. We're about halfway through the 3-week review cycle, so today I want to update you about the public health situation and the progress of our vaccination programme. I'll also say a few words about the vote in the Senedd this afternoon to extend the use of COVID passes in Wales. Now, at the end of last month, coronavirus rates in Wales reached their highest level in the pandemic so far. We had, and we continue to have, the highest rates of coronavirus in the United Kingdom. Now, the reasons for this are complex, as the First Minister explained in his press conference last week. Now, you can see from the slide on your screen at the moment how rates peaked at the end of last month at just over 730 cases per 100,000 people. The black line on the slide shows actual cases, and the blue dotted line shows the modelling carried out by Swansea University, estimating how the Delta wave would behave this autumn. As you can see by the black line, cases are thankfully falling. But at around 530 cases per 100,000 people, our rates are still very high. When rates of coronavirus are this high in all parts of Wales, we are inevitably seeing more people being admitted to hospital. The latest figures show that there are around 800 COVID-19 related patients in hospitals across Wales. The NHS is under huge pressure at the moment from the combination of winter illnesses, COVID, emergency demands, and trying to catch up with all the operations and treatments which were postponed during earlier waves of the pandemic. Mae Gwasanaethau Iechyd a'n gweithlu gofal yn gwneud gwaith anhygol, ond maen nhw wedi blino. Maen nhw wedi gweithio'n hynod o galed ac wedi gwneud popeth ni wedi gofyn iddyn nhw. Gallwn ni gefnogi'r Gwasanaeth Iechyd y gaeaf hwn drwy reoli lledaeniad y coronavirus ac atal mwy o bobl rhag mynd yn ddifrifol wael gyda Covid-19. Our NHS care workforce is doing an incredible job, but they are exhausted. They've worked flat out and they've done everything that we've asked of them. We can support the NHS this winter by getting the spread of coronavirus under control and preventing more people falling seriously ill with COVID-19. And we can do this by ensuring we've had both doses of the COVID-19 vaccine and having the autumn booster too if we're eligible. Having our winter flu jab will also help. We can also help by choosing the right service for our healthcare needs. If you need care for minor injuries and illnesses, your local pharmacy can help, and minor injury units treat a wide range of injuries. More information about common winter illnesses is available from NHS 111 Wales Online. Brechlynau yw ein amddiffyniad gorau yn erbyn coronavirus. Diolch i'n timau brechu gwych ledled Cymru, mae 9 o bob 10 oedolion yng nggrwpiau blaenoriaeth 19 wedi cael 2 dos o'r brechlyn. Vaccines are our best defence against coronavirus. And thanks to our fantastic vaccination teams across Wales, 9 out of 10 adults in priority groups 1 to 9 have had 2 doses of the vaccine. More than 3/4 of 16 to 17-year-olds have had a vaccine, and we're making good progress vaccinating 12 to 15-year-olds. Almost half of this age group have now had a vaccine, and all 12 to 15-year-olds have been offered an appointment. We're also making good progress with the autumn booster programme. We're providing a booster vaccine because the protection offered by the initial 2-dose course of COVID vaccine reduces over time. Everyone eligible for the booster will automatically be offered an appointment 6 months after they've had their second dose of the vaccine. Now, we're working through the priority groups in the order that people had their second dose of the vaccine. And this means that some people will already have had their booster, and for others, it'll mean that their appointment is on its way. Coronavirus has not gone away, so please say yes to the booster when your appointment comes and protect yourself this winter. We're making good progress so far. All eligible care home residents have been offered the booster, and almost 3/4 of residents have had it. More than half of 70 to 74-year-olds and 1/4 of 65 to 69-year-olds have already had the booster. As this slide shows, 1 in 5 people aged 12 and over has had a booster vaccine or a third dose of the COVID-19 vaccine. I want to remind everyone who hasn't been vaccinated or hasn't had their second dose yet that it's never too late to have a COVID-19 vaccine. Our website has all the details about how you can get one, and many health boards are running walk-in clinics. A dwi eisiau troi nawr at y pas Covid. Nid passport Covid yw hwn. I want to turn to COVID passes and explain that these are not vaccine passports. The COVID pass allows people to show that they are either fully vaccinated or that they've had a very recent negative lateral flow test. It was introduced a month ago for entry into nightclubs and to large indoor and outdoor events. And the feedback we've had to date has been really positive. It's been successfully used at both Autumn Rugby Internationals so far this year, and the WRU said fans were extremely compliant, and the vast majority of the crowd were seated 30 minutes before the match started. This mirrors feedback from Swansea and Cardiff football clubs, which have successfully been using the COVID pass at their home games since its introduction in mid-October. We've also heard anecdotal feedback from people using the pass that it's given them confidence to attend venues and events, knowing everyone else is either fully vaccinated or has had a very recent negative test result. Today, we'll bring forward regulations in the Cynhadledd to extend the use of the COVID pass to cinemas, concert halls and theatres. These are all indoor, ticketed venues where people are in close contact with others for long periods of time. Extending the COVID pass is one more way we can strengthen the measures we have in place at alert level 0 when rates are this high to help keep us safe and to keep Wales open. Now, I don't want to speculate on what the result of the vote will be, but we hope that, together with all the other measures we currently have in place, their use will help to bring coronavirus under control. Because we want to do everything we can to prevent the need for further, more severe restrictions of the kind we saw last winter. Diolch yn fawr. I'll now take questions from journalists. Can I start by asking Felicity from BBC Wales?
Minister, thanks very much indeed. I'd be grateful for answers in both languages, please. Could I ask you to expand on the Welsh Government's position on mandating COVID vaccinations for health and social care workers? England is doing it. You have decided not to on the basis that you already have high take-up. But obviously we are talking about some of the most vulnerable people to the predations of the virus. So could you just expand on your reasoning, please?
Well, we know that in Wales, 95% of our healthcare workers have taken the opportunity to have both the doses of the vaccine. So we think that those levels are very high, and we're content with those levels. We are still in the business of trying to persuade those final 5%, but there will obviously be amongst them some people who have medical reasons why they can't have those 2 doses. What I find shocking is that you have a situation where you have the UK government insisting on people in the NHS being double vaccinated, and yet the Prime Minister of the United Kingdom can walk into a hospital without even a face mask on. I do think that this underlines the degree of hypocrisy that's going on amongst the Conservative government. Mae'n unigol sefyllfa yng Nghymru lle mae tua 95% o'r bobl sy'n gweithio yn ein gwasanaeth iechyd ni eisoes wedi cael 2 dos o'r frechlyn. A dwi yn meddwl bod hwn yn dangos bod na nifer uchel iawn sy'n eisoes wedi cael y frechlyn, a dyna pam dyn ni ddim yn meddwl bod hi'n ofynol i ni ofyn i bobl ac i fyny bod pobl yn cael y frechlyn. Yn y gwasanaeth iechyd, wrth gwrs, mae gwaith yn mynd rhagddi ceisio perswadio mwy i gael y frechlyn, ond fe fydd rhai sydd gyda rhesymau meddygol am beidio cael y frechlyn. Ond dwi hefyd yn meddwl bod hi yn anhygoel bod Prif Gweinidog Boris Johnson wedi gallu cerdded mewn i ysbyty heb gwisgo mwgwd tra bod e'n gofyn i bobl yn yr ysbytau yna i fyny i bod nhw yn cael y frechlyn.
Diolch. And if I could move on to the issue of the expansion of COVID passes, the previous vote, you only got through the policy really by a fluke, which does illustrate the vulnerability of your government to its lack of a majority in the Senedd. You've been in talks with Plaid now for some months about an agreement to help you through some crucial votes. Could you give us a sense of how that's progressing and how far away we are from an announcement?
Well, those discussions are continuing. They've gone into quite a lot of detail in lots of different subject areas. The First Minister will, I'm sure, when he's ready to make any further comments on this situation, but the discussions have not concluded, and those negotiations continue. Yn amlwg mae Mark Drakeford yn cario ymlaen gyda negodi gyda Plaid Cymru. Yn amlwg fydde fe lot yn haws i ni i gael fwy o gefnogaeth oddi wrth Plaid Cymru. Mae'r trafodaethau yn mynd rhagddi, ond mae fyny i'r Brif Gweinidog Mark Drakeford i wneud unrhyw fath o gyhoeddiad, ond dyn ni ddim ar y pwynt yna eto. Mae'r negodi yn dal i fynd yn ei blaen. Can I ask Adrian Masters, ITV Wales, please?
Thank you, Minister. Could you say a little more about the booster jabs programme, please, and explain why you are not offering it to people who had their original jab 5 months ago, as is happening in England? Is there a reason why you're sticking to the 6-month period?
Well, my understanding is that JCVI is still suggesting that people stick to the 6-month interval, and we've seen what happened in Israel when there was a much shorter time frame between the first and second dose, which meant that they did see their rates go up. So that 6-month interval is what the scientists are advising. They have allowed a certain degree of movement around that 6-month period, but we are working through the people who need that booster jabs on a very priority order, which is different from the way they're doing it in England, which is a little bit more of a free-for-all where everybody's invited. We think it's important to vaccinate the most vulnerable, and that's why we're going in that order.
Thank you. And could I ask whether you are concerned about any potential gaps in the provision of vaccination for 12 to 16-year-olds? The reason I ask is today I've heard about a 13-year-old in Swansea who didn't get the vaccination appointment that he was promised and now has COVID, and has reported to us as well that lots of his friends haven't had their appointment either. I realise that you said it was quite a large number of invitations have gone out. Are there any gaps in provision that you're concerned about?
We know that 12 to 15-year-olds have been given that invitation. About 48% of them have taken up that opportunity. We'd obviously like that figure to increase. there are opportunities, and lots of people took up that opportunity over half term, but we would encourage parents and children to come forward for that vaccination. We have seen the rates decline in our schools, and so we're really pleased to see that happening, and we do think that the vaccination is helping in that space. So I'm not aware that there are gaps in terms of the offer to 12 to 15-year-olds, but obviously what is important now is that people take up that opportunity to have that offer, and there are walk-in opportunities for those 12 to 15-year-olds as well.
Thank you.
Laura Clements, Wales Online.
Yeah, thank you. My first question today sort of picks up about what you were saying about the NHS and the work that they're doing at the moment. You sort of said previously that COVID restrictions may have to be introduced if the NHS remains under pressure in Wales. And if you look at it today, the number of people in ICU with COVID is still rising. And compared to this time last year, it's up about 150%. So are you able to perhaps give us an update on the risk of restrictions coming back this winter, especially given the situation in the NHS?
Thank you. Well, I've got to underline the fact that the NHS is under incredible pressure. We've got to think about the staff who've been working incredibly hard, but I do think that the public need to understand that they also have a responsibility here to take the pressure off the NHS, to make sure that they take up that opportunity of a vaccine, but also that they look for alternatives if it's not genuinely an emergency. ICU, there are about 72 people with COVID in ICU at the moment. Clearly, we're keeping an eye on the situation. We're trying to make sure we understand the difference between the normal winter pressure and the winter pressures that are here because of COVID. Now, it's very difficult to disaggregate them, but we'll be keeping an eye on the situation, and the rule that we're working to constantly in terms of whether we will need to lock down further this winter is all going to be about whether the NHS becomes overwhelmed. And so we will clearly be keeping an eye on that. It's under amazing pressure at the moment, and clearly winter hasn't really started yet. So the flu vaccination programme is really important. We're slightly disappointed that not more people have taken up the opportunity of the flu vaccination. So fewer as a percentage have come forward this year for their flu vaccination compared to last year. So I would encourage people to take up that opportunity, and we have extended that opportunity to a wider age range this year as well, because we are really, really fearful that that pressure could overwhelm the NHS.
Okay, thank you. I suppose my next question sort of follows on from that a little bit. You have to get on the train or walk into a shop to see that people aren't really wearing their masks perhaps as well as they could or should be. And you've sort of highlighted the additional restrictions or measures that might come in place with the COVID pass. Do you think it's fair to ask businesses to accommodate those extra restrictions and measures when the current measures that we've got in place aren't actually being followed or implemented properly?
It is the responsibility of the public to follow the legal requirements, and the legal requirements are that you need to wear a face covering in indoor public places. So people need to understand their responsibilities here. We have been speaking to local authorities, to the police and to other organisations to ask if they can do more in terms of enforcement. But frankly, we need the public to come with us on this. That's the only way we're going to get out of this situation. It's all our interests for us to work together on this, because it's not just us that it's going to suffer, it's our parents, it's our grandparents. This is really about protecting those we love. And of course, we would only ever extremely reluctantly extend the situation in terms of further restrictions if we absolutely have to. This is not something that we want to do. It is simply something where we believe that every little tiny measure could contribute to us bringing those rates down. And I do think it's important people understand that we're going to be entering an incredibly difficult winter. That those Christmas gatherings where so many germs and are passed around, we need all to be careful during the build-up to Christmas to make sure that we understand our responsibilities, not just to protect ourselves, but to protect those other people around us. Can I ask for the next question from Mike Hughes, LBC?
Minister, thank you very much indeed. Can I just pick you up on that last point and to tie it in with the expansion of the COVID pass? If you don't secure enough votes in the Senedd tonight to expand the COVID pass, where do we go from here? Does that automatically mean that you will look at more stringent restrictions if you fail to secure enough votes to expand the pass tonight?
Look, let's wait until we've had the vote. I think that's the most important thing. We'll see what that outcome is. As with everything with this pandemic, we are actually taking one day at a time. You know, we never know what's around the corner in relation to this virus. And so, of course, we try to make longer term plans for the future, but very often we're knocked off course by some surprises. And the fact that we now have a kind of sub-variant of the Delta variant, so the AY 4.2 is something that we need to keep an eye on, that it looks like that spreads even faster than the Delta variant. And we know that the Delta variant spreads around 1,000 times faster than the Alpha variant did. So all of this is not good news, and we just all need to understand that this problem has not gone away.
Thank you very much for that. I mean, with respect, I mean, you must understand, and you clearly know that, you know, the last vote went through on a complete knife edge, and as Phyllis has already picked up, by almost a miracle that you managed to secure that. You must have a contingency of sorts. I appreciate you're taking things day by day, but you must have drawn up a plan off the back of if you don't secure enough votes. And can I just pick you up on Christmas as well? I mean, you know, we've had bonfire night and we've had Halloween now. People are very much turning their attention to Christmas gatherings. I appreciate that you're unable to give us a full picture on how Christmas is going to look in terms of restrictions, but can you at least commit to giving people far more notice this year if you are going to bring in restrictions compared to last year?
Well, obviously, we didn't plan last year to have a situation where we had to close down quite so quickly. That was something that was brought about because it was absolutely clear that the spread of the virus was much quicker than we had foreseen. And certainly we would hope not to be in that situation this year, which is why it makes sense to act early. And that's what the JCVI tells us all the time. That's what our scientists tell us all the time. If you're going to act, act early. And that's what this suggestion today in relation to the COVID passes is really about. It's about acting early. It's about those little marginal gains that all make a difference. And let's be absolutely clear that this is to try and make sure that those facilities remain open over the winter months. That's what we're trying to achieve here. But clearly, if the situation goes in the wrong direction, we constantly will keep that situation under review. Harry Hansen.
Thank you, Minister. I wanted to ask you about the flu vaccination programme. School children who missed their flu vaccinations in school due to illness in the Swansea Bay Health Board area are able to go to drive-through centres. With the flu vaccination programme being so important this year, is this something that the government may look at rolling out across the country?
Well, it's great to see that there are lots of different models all over the country in relation to how flu vaccination is rolled out. Clearly, we need the rates to increase from where they are at the moment, and if there are opportunities for people to use drive-through facilities, I know that they exist in Swansea, as you say, they exist in Cardiff. There are other areas where those facilities exist. So certainly, if that is something that we need to look at further, we will consider that.
Thank you. And also, I wanted to ask about the vote tonight on the COVID passes. If the vote goes ahead and COVID passes are extended into places like cinemas and theatres, what government support will be on offer for these businesses which are going to be impacted by that?
Well, these are facilities where people's tickets are checked anyway before they go in, so we don't think it is an additional huge burden for them to ask for those COVID passes to be shown as well. So we're confident that they have it within their ability to extend the checking of passes to the COVID pass. Tom Magner, Carers World News.
Thank you very much indeed, Minister. Apologies for only being on sound today. Can I develop the first question from what you said earlier about the exhaustion of care workers? Clearly no one disputes that. But what our viewers as unpaid carers remind us all too frequently that they too are exhausted, often caring 24/7 and for years in some cases. Now, it's clearly not a competition about who is more tired. But the fact is that 96% of care across Wales is delivered by unpaid carers. So rather than just being a part of your thinking, should they not be at the forefront of your policy thinking?
Well, Tom, I can assure you that we are incredibly concerned about the situation that carers have been under, both paid and unpaid carers. And that is why we've brought forward an extra £42 million to help them through this winter. We've targeted that support at unpaid carers in addition to paid carers. We've also extended that opportunity to access that funding to the voluntary sector because we think there's a role here for them to maybe take some pressure off those unpaid carers. I can assure you, Tom, that we are very, very focused on the situation in relation to care. I have weekly meetings with the health boards and the local authorities to make sure we get into a better place on this. We are absolutely clear that we can't fix the situation in relation to health without fixing the situation in relation to care. So a lot of our time is being spent on making sure that we can get to a place where we can make an early offer on at least the living wage, but also giving that support that is necessary to those unpaid carers, as you suggest.
Thank you very much indeed for that. A lot of our viewers' attention this week has been directed to what's been going on at Westminster about comparisons between ministers and MPs' salaries and second jobs, etc., in comparison to the carers allowance. I'm not asking for personal details, and certainly that level of controversy doesn't appear to have struck the Welsh Parliament and Welsh Government as yet. But how much of a factor is it that given the carers allowance over a year is £3,515, our viewers wonder how ministers can possibly understand what it's like, even given your answer to the first question?
Well, thanks very much, Tom, and we appreciate the incredible work that the unpaid carers have put in under such a prolonged period of time. We know that respite is needed, and that's why we have put that additional funding in, as I suggest. And obviously we did put that additional support in prior to that earlier on in the pandemic as well. I know that has come as a great relief to many unpaid carers, and I'm very pleased that we've been able to extend that offer now to more people who are in a situation where, frankly, they do need that support, and we're very keen to give them that support.
Thank you.
Diolch yn fawr i chi gyd.